Hi YouTube, it's Carmen. I'm almost 14 months post gastric bypass. I will be on December 1st. Today is November 19th, 2013. Highest weight ever was 283. My day of surgery, October 1st, 2012, I was 217. And today I am back up to 128 pounds. Yay! I got down to 125 and started to panic a little bit, but I have been eating and trying to get in a little bit more calories, and I bought a whole bunch of like individual protein bars instead of the boxes to sample which ones I like, and my kids will eat the ones that I don't like, or Justin will eat the ones that I start and then don't like, so that's not an issue. I haven't found any one that really works for me. I did find the Cliff Bar bodybuilder ones. They got 20 grams of protein in one bar and I think only 5 grams of sugar. Not sure. But the chocolate mint, I could eat most of the bar, but I had a problem finishing the last like quarter of the bar. I am 3 weeks post-op from my latest bowel rupture. And I'm sore, but I'm doing okay. Sorry, I need a drink. This is my shirt that Justin bought me for my birthday, and I love it. I'm not wearing my wig today, but I was cold, so I put this on. But look at how thick my hair is getting. Ah! Right? I totally love it. It's getting thicker. It's finally starting to grow, and my nails. Look, my nails are starting to grow. They're not chipping and breaking anymore. Even my eyebrows are growing. I wish my eyelashes would grow, though. Anyways, I went to the doctor today to talk to him about the pain that I've been having, because I've been in so much pain since I've been home, and I can't figure out why. I still have a lot of pain in my left side, up under my ribs and here, and it's still pretty swollen. I'm having issues where even just touching my skin like that just is too much. It hurts. It's like ants or fire ants, and it's painful. My legs have been the same way. They have been really sore, and I'm just in more pain than I should be. I've also been having a lot more dizziness, and every day this week I've had a headache. Only one migraine out of the whole thing though, so that was lucky. And that was on Sunday, so Justin was here to take care of the kids. And I ended up spending the whole night in bed. I needed it quiet, I needed it dark, and yeah, so I ended up spending the night in bed. Sorry, this is really bugging me. There we go. So I did go see my doctor today. Just my regular GP. And the tube that goes from your ear drains down into your throat on my right side is blocked off. So because it was like that when I was in the hospital, we know that antibiotics wasn't going to help because I was on tons of antibiotics in the hospital. So, and then oral steroids, he said, could mess with the ulcers, make things worse. So we're doing a nasal one that sprays up in here, and hopefully that won't hurt my ulcers at all. So we're going to try that for some of the dizziness and my headaches. And if it doesn't clear up in 2 weeks, I go back to see an ear, nose, and throat specialist, blah, 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 whatever. Everything from surgery looks good. He can't tell me why I'm having so much pain, and he didn't give me anything for the pain at all. I have nothing. But he is sending me to a neurologist because he thinks I have reflex sympathetic dystrophy, or RSD, or it's also called complex regional pain syndrome, CRPS. And what that is, it's here, I'll just read it to you what it is. It's a rare chronic neuroinflammatory disorder. It occurs when the nervous system and the immune system malfunction as they respond to tissue damage from trauma. The nerves misfire, sending constant pain signals to the brain. It generally follows a musculoskeletal injury, a nerve injury, surgery, or immobilization. The symptoms, you can have all or some of these symptoms. Pain, which is described as deep aching, cold burning, and or increased skin sensitivity. I have that. The presence of an initiating noxious event, a sprain, fracture, or minor surgery. Obviously, I just had surgery. Pain moderate to severe associated with allodynia, or pain from something that should not cause pain, like when I touch my arm, when my clothing touches my skin. I have that pain too. Continuing pain, moderate to severe, associated with hyperalgesia, which is heightened sensitivity to painful stimuli. So like if you were to poke me with like a needle or something, it would be more painful than what you would expect. And I guess that's what this is right here. Abnormal swelling in the affected area. My doctors always say I swell way more than the average patient. Abnormal hair or nail growth. Nothing more than usual, but I've had symptoms of this for years and years and years, so who knows. Abnormal skin color changes. I don't have that. Abnormal skin temperature on one side of the body is warmer than the other by more than 1 degree Celsius. I don't have that. Limited range of motion, weakness, or other motor disorders such as paralysis or dystonia. Obviously, yes, I'm very weak, and I have the muscle twitches and my tremors. My tremors get really bad when I have trauma or stress. It gets a lot worse. Let's see. Symptoms and signs can wax and wane. They can get better, they can get worse, they can go away completely and then come back out of nowhere. Yes, that happens. The pain is continuous. It can be heightened by emotional or physical stress. Limbic system involvement suggests a propensity for trouble with sleeping, mood, appetite, and sexual desire. In a study of 824 with CRPS, 92% have insomnia. I have to take a sleeping pill or I don't sleep. And I have to take Ambien. I take Zolpidem every night. 78% have irritability, agitation, or anxiety. I've been dealing a lot with my anxiety and paranoia lately. And I have my mood disorder. I'm schizoaffective. An affective disorder is a disorder of the moods. 73% have depression. Talked about it before. I'm very depressed. 48% have poor memory and lack of concentration. And we've talked about this too before, and you have actually seen it in my videos, how I just kind of forget what I'm doing or can't concentrate on doing what I'm doing. Anyways, so that's what I'm looking into, seeing a neurologist for that, and it's possible that I have that. It's treatable, not curable, and it is associated with MS, and so is this, my essential tremors that I have that make me shake, are also associated with Parkinson's and MS. So yeah, anyways, I wanted to show a full body shot with my awesome shirt for my birthday. I'm still swollen a little bit, but I'm wearing very control top leggings. They are holding in a lot of the swelling, but I do have some swelling. Oh, and another side of the disease, the dysfunction that we're looking into, is when you have trauma to one area and you have pain that's not associated with that area. That's the pain in my extremities from this surgery. Anyways, this is what I look like today. This is not my hip bones, this is fat. Just letting you know, it looks like hip bones, but it's not. Like I said, I'm swollen, but I am wearing very tight see if I pull this down. You can see how swollen I am. Ow. And I've had people ask me if I'm pregnant. Just because I am so swollen. I'm not pregnant, I'm just dealing with surgery. And the back. And, oh, the other side. And that's what I look like at 128 pounds. I feel like my hands look really big, but they're not. Anyways, that's what I look like. And ask me any questions. I've been having problems eating with the pain. It's right here. I've been having problems eating. So that's why I'm having issues. Anyways, ask me questions. Like, subscribe. Have a good one.